I'm Tracey and I'm representing Natalie, who couldn't be here today, and the rest of the Dementia Design Group. This presentation is going to start with a couple of statistics about dementia and then tell you about the evolution of the Dementia Design Group that originated here at Salford and its transition to the International Dementia Design Network. The Forget-Me-Not flower represents dementia, for anybody that doesn't know. In 2010, 35.6 million people have dementia, and that's set to double every 20 years. So it's a really significant issue, and no wonder really that government policy, funding and academics are expressing a lot of interest and concern about that fact. At Salford we have a real world focus around wanting to do research and education around this issue. In terms of other demographics, the dementia has US dollars of $604 billion spent on it in 2010, and that cuts across informal care, social care and medical care. This slide is meant to show that you can't always tell who has dementia. Some of the myths around dementia being amongst people who are very, very old and frail is not true, and I don't know who has dementia here apart from the lady at the bottom left, Anne Johnson, who collaborates with us and others very regularly and is a dementia sufferer herself. Our work around dementia is focusing on the non-pharmacological side of things, and in particular focusing on design and care, the way care is implemented. This slide just shows a few of the people that helped to get the dementia work off the ground. In particular, we're supported by Head of School Tony Warren, that's Natalie and Ricardo, your next speaker, Dr. John Zeisel, who I'll say more about in a minute, Elizabeth Collier, myself on a good day, and Maria Burke, who's going to speak in a moment as well. And this represents the teamwork Natalie catalysed through a Florence Nightingale Travel Fellowship, a visit to Dr. John Zeisel's Alzheimer care facility in the USA. And as a result of her work there, came back, made contacts with Ricardo in School of the Built Environment and others. And before you know it, here we are today, and a lot more has happened. Things kicked off largely with us having a listening event, getting people together to actually do some group work around what are the shared issues, what are the gaps in evidence that perhaps we can contribute to. And this listening event, which was in September 11, came up with a number of findings different to what's there in the literature around the care environment and issues like that. And some of the workshops were around looking at pictures of accepted best practice around dementia, but we asked people who were attending, the whole mix of people, the public as well, and they were saying things like this. Well, signage, we might think that's good, but they were saying it's not, it's cluttered, it's high up, they don't always look at that level when they're trying to navigate. And similarly, this might be a good attempt at getting the outside into a building. It's light and it's airy, people can feel like they're accessing the outside, but in actual fact people told us that actually no, that feels a bit like prison, and they don't actually rate it at all. This is, I've been going around the northwest photographing toilet doors. It's just to try and say design is for everybody, even if you've not got a visual impairment or dementia. Just trying to find what a toilet door looks like nowadays in a pub or a public place can be quite difficult. The International Dementia Design Network then, these plans evolved from the Dementia Design Group as a Salford-based initiative because we recognised we wanted to reach further than that, and we've now got collaborators from the USA, Australia, and across Europe, and obviously around the UK. And we wanted to look at design in its broadest sense, including disciplines such as computing, robotics and art. This is a picture of the International Dementia Design Network, and it just happens to have a picture of a local MP, the Right Honourable Hazel Glaze, who's an avid supporter of our work, and he's just trying to illustrate that we think it's a global concern and we shouldn't just be looking at developed countries but underdeveloped countries too. And the group then went on to do its first conference, which was a huge success with 130 delegates, oversubscribed. And again, there was workshops celebrating what Salford does well around dementia design. And we worked with a lot of partners like Pizzoni Architects and Find Signage, which are companies that work closely with us. And for that event and our subsequent web design and documents that we produced, we've got this wonderful logo and an explanation developed by graphic designer John Rooney, which you can read that another time, but perhaps we'll make you look at the website to see what it's all about. But we didn't want a medicalised or perceived negative image. We wanted something positive, which that is. This just illustrates some of our partners, which are growing in number all the time. We are also, as well as partners, looking for sponsorship. If anybody listening to this at a later date perhaps may be able to help with that. But we certainly want people to sign up on an individual level or an organisation level to the work, get on the mailing list and hear more about what we do. We're just in the process of developing a research strategy, and an example in the time I've got is how we're working with Find Signage to see if we can't develop an evaluation of their crockery developed for Alzheimer's patients, which currently is flying off the shelves around the NHS and social care nationally. It needs proper rigorous evaluation. In terms of innovation, we have a number of activities going on, including the building of a Dementia Design Network Hub, hopefully, on the university campus, to test new technologies, and also perhaps a model kitchen and a special garden area. And in terms of education, we've been doing continual professional development now for 6 years at least to a substantive level, and we do an awful lot around that nationally, locally and bespoke. And just to finish, our philosophy is one of trying to work with people with dementia and informal carers, let's not forget them, and others, to look at dementia in a positive way, finding the best in a reciprocal relationship, working with people with dementia. And then lastly, contact details should anybody want to sign up to the network, more information, any ideas of things we should be looking at, sponsorship, did I say sponsorship? Please follow those. And anyone who can do Twitter, please do it. Thank you.